Thank you for coming. This is really a follow-up on the press conference that we held on Monday. As you know, at that time I declared a state of emergency, which was ratified by the Board of Supervisors on Tuesday. This declaration of emergency, of a local emergency, gives us more flexibility to access both internal resources within the county, such as help from other departments, as well as resources in the region, the state, and the federal government. And it gives us more flexibility in the response. At that time, I also explained that it appears that we are seeing more severe disease from H1N1, which continues to be the main flu virus that is circulating in our community right now. I also said at that meeting that we had received some doses of H1N1 vaccine in the public health department, and I can now let you know that we did receive 36,500 doses of the 50,000 that we had requested in a variety of presentations. As you know, the vaccine comes both as an injectable and a flu-mist vaccine. It has been very frustrating for this community in that the request and the need for vaccine is much higher than the availability of vaccine. And we are trying to be responsive to our community. It is unfortunate that the information we get about availability of the vaccine is sometimes, unfortunately, unreliable, and the shipments to the providers in our community are unpredictable. Trying to be responsive to our community, we have decided to share the vaccine that the Division of Public Health received with our hospitals that have not received any yet. So today we will be sharing a large portion of the vaccine that we have already received with the hospital systems in our community that have not yet received vaccine. We will monitor the situation daily, and should vaccine not be shipped to other community providers, we will assess and share the vaccine with providers, doctors, and clinics that serve priority populations, such as young children, pregnant women, etc. What I am telling you, the situation with the vaccine changes so much that we will be changing what we do day by day. At this point, we do have 41 clinics for the public scheduled starting the 16th of November. Depending on whether or not the vaccine that we are lending the hospitals can be returned to us in time, we may consider postponing the opening of the county H1N1 vaccination clinics. At this time, the schedule remains as it is, but we will reconsider opening these clinics depending on the situation with the vaccine. If you recall, when we first planned these clinics, it was the expectation that the vaccine would be widely available throughout the community. And by the time the county clinics would open, these are safety net clinics for those who had not accessed it in any other way. Since the vaccine has not been available widely, we will consider whether or not we should just send the vaccine to be widely available throughout the community, as opposed to having one clinic a day, every day for a couple of months. With that, I will end my remarks and answer any questions you may have.
How frustrating has it been? You asked for 50,000, you didn't get that, and I'm sure 50,000 was a lower number than what you probably wanted anyway. Just with the availability of it from your perspective, how frustrating has it been?
Well, I think it's been frustrating for everybody. It's been frustrating certainly for staff, but it's frustrating for the public who has been urged to get the vaccine, and when they try to access it, it's not available. And I'm sure it's frustrating for those who are distributing the vaccine, because I believe everyone's doing the best they can. The numbers of vaccine did not become available as quickly as everybody expected. So yes, it's been frustrating, but you can also look at the fact that so many people actually want the vaccine this year. And that is a different situation than what we have many years when seasonal flu vaccine is available, and we sometimes have to waste the doses because not enough people wanted to take it. So you can look at it both ways. Yes, it's been frustrating, but hopefully that frustration will end when the vaccine becomes more widely available.
And I wasn't here on Monday. numbers, did you give out numbers Monday, and are there updated numbers today that you guys have to the county?
The 36
cases.
On Monday, I could not give out a number because we were still counting the vaccine. And I know that it seems odd that it would take us a while to count the vaccine, but when you don't have staff, you have to pull somebody from somewhere else to do the counting. So actually, I was asked over and over again to say how many doses had been received. So that's why I'm announcing today that we received 36,500 doses.
I'm sorry about cases, cases in the county.
The county has had 323...
333 hospitalized.
Thank you. 333 hospitalized cases. We've had, unfortunately, 15 deaths from H1N1 since the beginning of the epidemic in April.
What about going to your own private physician or your medical group? Would they have it, or is it just the hospitals?
We are hoping that this week, private doctors and medical groups will be receiving the shipments of vaccine. Anecdotally, I'm hearing that even today, at least 2 providers received some H1N1 vaccine. We will monitor the situation every day, and if we hear that more vaccine becomes available through private providers, we will certainly let the media know. It will be up to the providers to notify their own patients and the people that they serve about the vaccine availability. But this is what I'm talking about, the unpredictability of the vaccine distribution. We just don't know when it's going to come in. But we do expect and hope, and I know that the State Department of Public Health is trying to ensure that Sacramento gets more vaccine delivered in this community.
One email I know our station got was some viewer was saying that Kaiser got shipments, but the other hospitals did not. Is there any reason why Kaiser would get them?
Well, I actually found out today the reason, and yes, Kaiser did receive its shipment directly from CDC earlier than anyone else. And Kaiser, as you know, is a large provider of healthcare in this community. So Kaiser members have had access to the H1N1 vaccine. Kaiser and other managed care organizations participate in a network of vaccine safety providers. They will report directly to the CDC and to the FDA any adverse effects of the vaccine. So Kaiser and these other large managed care providers did receive vaccine ahead of everyone else, and they have been monitoring for the rest of us adverse events to this vaccine.
And that was part of the deal then, that if they get an earlier shipment, then they monitor the events?
I believe that there probably is a reason why they got it first, so that they could monitor the safety of this vaccine. In addition, Kaiser supports the Department of Public Health, the California Department of Public Health, by having sentinel physicians. The way we know what flu viruses are circulating in the community is by testing people who come in with influenza-like illness. And Kaiser is one of the large sentinel providers that do this testing and send it to the public health laboratories.
Have there been any problems with the vaccine that you've heard of?
You know, like all medication, no vaccine is 100% safe. I have not heard that there are any adverse events that are in a higher amount and a higher number than with regular seasonal flu vaccine. And we really don't expect there to be, because this vaccine has been manufactured in the same way as seasonal flu vaccine has been manufactured, tested in the same way. And it's now actually being monitored, I think, at a higher level than seasonal flu vaccine normally is. Certainly for the county it is.
So all in all, you're saying that some of the clinics that the county health department has posted for the shots may be eliminated?
We will be considering, depending on the availability of influenza vaccine, if there is sufficient in the community, then we will hold the clinics as scheduled. If in the next 10 days there isn't sufficient in the community, then we may distribute what we have to the community clinics and providers and postpone our own vaccine clinics till later in the year.